change in one or more of those facet joints. And when you slept that way and you didn't have your normal pillow, which perhaps gives you some really nice unloading while you sleep, you woke up and, oh my God, I'm so stiff and I can't turn my head, okay? I doubt this is pathology, Susan, okay? Especially because you had a prior 1 or 2 visits with Raw and improved your mobility substantially. Okay, so you know that.
I'm not concerned about it.
Okay, but you need to be able to do.
Manage.
Yeah, so I can snap, crackle, and pop you. I can stretch you. I can mobilize you. I can do all those things, and you leave feeling like $1 million, and then shoot, 2 days later, you're right back in the same spot. So, what good does that do us, right? Tissue, joint, mechanics, exercise, strength training. Okay. I don't know what you're doing right now with your strength training program, but maybe something is aggravating this, because every time you push, pull, particularly overhead, okay, you're going to compress the cervical spine with a lot of the musculature that attaches to the shoulder girdle and also attaches to your cervical spine segments. So we have to look at all of the exercises and decide, are some of them, 1 of them, 2 of them, actually compressing your neck? And if so, what can we do to adjust? Okay, so without further ado, feet flat on the floor, please. Scoot forward and just hands here resting. Turn your head to the right, please. Okay, what symptoms do you get? Because your whole body's starting to go with your head. So now try to turn your head to the right. That's it. Okay, where do you have symptoms? On the right. Okay. And it's in the front like that? It's not in the back?
No, that's right.
Right there. Okay, how about turn to the left? So very, very restricted mobility. Symptoms when you turn to the left as well? On the right again. Okay. And then how about straight down? You okay there? On the right again. Okay. How about straight back? On the right again. Okay. It's a common theme. Okay. Now, toughest one for the last, okay? Just what we call side bend. Other than just being real tight over here, painful?
No.
Okay, and how about trying to close to the right? Painful or just a stretch on the left? Painful on the right. Okay, so congratulations. You've got some, facet joint arthrosis, mobility problems, stiffness, whatever you want to call it, on the right side of your neck. But now we got to get a little bit more specific. So now we're going to do a mechanical exam, okay, for your cervical spine. Okay? Questions so far? Okay, lie on your back, please. We're going to make you comfy. Put a little wedge underneath your legs. Here you go. Lift them up. Okay. All right. So right now, there's not going to be any cracking, popping, mobilizing, or anything like that. It's just an assessment, okay? How do your joints move, and what kind of feedback are you going to be able to give me while we do this, okay? And the first thing that we're going to do are what we call lateral glides. You don't need to do anything other than just hang on, relax, go for a ride, and give me some feedback about how this feels, okay?
That way it hurts.
When I push that way,
Yeah.
and it hurts on the right?
Uh-huh.
Okay. And how about here?
Fine. Ow.
Because that really feels stiffer. This feels stiffer than this, but you get symptoms when I push left.
Correct.
Okay, and the symptoms are all on the right?
Correct.
Okay. And now a little bit different. Okay, you don't like to open there. And that corresponds with your lateral glide assessment. Ow. Ow. Okay, and we're going to go the other way. And that's okay.
Correct.
All right. So you have an opening restriction on the right, and if I had to localize even further, there's C7. We're going to say it's right there.
Yeah.
Is that your most painful segment?
Correct.
Correct. Okay. So we're going to start with just very gentle traction, which is just an unloading. We're going to let your muscles relax. How you doing?
Great.
Feels nice?
Uh-huh.
Uh-huh. Stay there all day, please. Good.
No pain.
No pain. We like that.
I like it a lot.
So, no pain is great, but full unrestricted motion is even better. So, that's what we're going to shoot for, because right now you can't even look over your shoulder to change lanes in your car based on your active range of motion assessment we just did.
That's why I had someone drive me.
Okay, smart. Did Tara bring you?
Yes.
Oh, she did. Okay, wonderful. She and her hubby are quite the runners. I see them running like billy goats all over the place.
And they also ride bike.
Uh-huh. Very, very active people.
They don't have pain.
Yet. Whether it's episodic or chronic, if you're human, you're gonna have some musculoskeletal pain at some point. You guys know anybody who's lived their entire life without ever having any pain? Not me.
I've met people who are like, oh, 55, my first injury ever.
Yeah.
But eventually, yeah.
Well, they're very fortunate.
I'm still waiting for injectable WD-40.
Joint juice. Yeah. We could all use some joint juice. Yeah.
But we have to have it self-injectable.
Amen to that. That would be nice. So when you mobilized her previously, you went opening HVLA on the right, or you went?
So she never had symptoms on the left side whenever I moved. So I side bent to left and I rotated to right. Eventually she was left and I just.
But which direction was your thrust? Toward her left axilla. If you side bent left, rotated right.
It was towards the right side.
Okay. So you took your primary lever in side bend, your secondary lever in rotation. So you were doing a closing mobilization on the right, thrusting down toward her left axilla.
Yes. Yeah.
Okay. Closing on the right.
Yeah.
Perfect. Okay.
Sometimes I need to do it.
All right, Susan, so before we do anything to do at all with your joints, because those are strong tools and we can do them anytime, we're gonna stretch, okay? We're just gonna do a very, very general.
Yeah.
What'd you get? Big pull, big stretch. You weren't expecting my shoulder to smash your forehead, were you? You okay?
Uh-huh.
I'm doing what we'll call a chin tuck on steroids, okay? This is called capital flexion. We're taking your head and we're driving it straight backward on top of your neck to stretch out the suboccipital muscles.
I can feel it opening.
You can feel it opening. Beautiful. It's good. Splenius capitis, rectus capitis, obliquus capitis. These three little muscles that attach our head to our neck, three on each side, right at the base of our skull, and they resist capital flexion. So we're stretching them a little bit. Okay, now we're going to go to levator. And then we'll go to upper trap. But first, just a big stretch here on the right side of your neck. You okay there?
I am.
All right.
I tried doing this today.
Were you able to get it at it with this much intensity?
No. This is not part of self-management.
It can be, as long as we teach you, an aggressive way to do it. I can stretch this into oblivion for myself, but it's just about knowing which levers to pull.
Okay.
Okay, there's the right, and now we're going to stretch the same muscle on the left, okay? And as I'm very gently mobilizing you and moving you around, I can feel what we call crepitation in my hands. So I can feel your joints kind of grinding across one another, even in my hands. I can feel that. So we know that there's some underlying arthritic change, some degenerative change between the facet joints, and that's okay. Like I said before, I've got it too. I'm over 30 years old, and that's when that process starts. So nothing to worry about, just something to be focused on managing. Good. Okay, trapezius. This one you're going to feel a little bit more specifically in your neck, okay? We're going to side bend you away. We're going to rotate you toward, and we're going to flex you forward a little bit, because trapezius is what we call an ipsilateral side bender. It bends us to the same side. A contralateral rotator, it turns us to the opposite side, and it's an extensor. So to stretch it, you have to do the three movements in the opposite direction. Doing okay?
Mm-hmm.
Excellent job. You feel that right there on the right side of your neck?
I feel it lower.
Okay.
Now I do.
Boom. Did you feel that little cavitation?
I did.
Feel that little joint go pum, pum, pum?
heard it.
Yeah, it came apart. And that was just from an aggressive muscle stretch. So I think maybe, perhaps, part of the phenomena that you're experiencing has to do with muscular compression, because if we felt those two little cavitations, those two little joint releases, just under prolonged muscle tension without specifically locking and trying to manipulate the joint, I think that some good tissue work and some regular muscle stretching will do you some good.
I'm all for it.
Okay. Nice work. now. We're gonna go back to the traction, the no pain, as you said earlier.
Yeah.
Okay, good. And before we do anything else, we're gonna reassess. Because remember, part of our treatment paradigm as physical therapists, treat, reassess. Did it work? Did it not work? Did it make a change? Did it not make a change? And if it didn't, well, that treatment technique goes a little bit further down the list. Maybe we'll revisit it, maybe we won't. But the idea is to only stick with treatment modalities, manual therapy, exercise, etc., that actually make a constructive change in your presentation. If they don't, we're not going to stick with them. Okay. Let's get you up to sitting. Glasses are there. Take your time. Thanks. Ooh, felt another one there. As you were getting up, did you feel that?
We like cavitation.
Yeah, cavitation is nice.
We like it.
Okay, so just in general right now, sitting here after the aggressive stretches, how do you feel?
Fine.
Okay, try to turn. See how you do.
Better.
Much further mobility to the left especially. Okay?
But at least I can do
You can turn.
Well, that hurts more.
Okay, so you're still restricted turning to the right. You notice that? But turning to the left got a lot better.
Yeah.
Okay, so are you open to me doing a technique that will allow you to turn a little bit further to the right? Okay, slide back a little bit on the exam table. Let's take your glasses off and set them on the table beside you. Okay, so remember that as you turn your head to the right, if you think of your vertebral segments, the spinous process, this little spiny guy back here, it's going to move to your left as you turn your head to your right. And if you turn your head to the left, then the spinous process is going to move to the right. Okay? So what we're going to do is I'm going to take your right arm and I'm going to slacken your upper trapezius and your levator scapula. So I'm going to take the muscle tension away from the system. Okay? I'm going to target your C7 vertebral segment, and I'm going to find it by doing a little bit of a first rib depression. And there's C7. And I'm going to take some tissue and I'm going to use it as a pad to block the movement of C7. And what we're going to do is we're going to turn you only until I feel that initial tiny bit of movement in your spinous process. There it is. Okay, you all right so far? Mm-hmm. And I'm going to side bend you gently down to that level. There it is. And then I'm going to take your zygomatic arch at your cheek and I'm going to just rock you sideways. Are you okay? Mm-hmm. And when you give me the green light or permission to give you a little bit of an impulse or a thrust, I will do so. You okay? Mm-hmm. May I proceed with the technique?
Sure.
Okay.
Oh!
That's the typical response. Oh! You did great. And that was probably, I think I felt 3 cavitations way down at the base.
I heard 2.
Okay, way down at the base of your
Sorry.
cervicothoracic junction. That's okay, that's okay. That was a very worthwhile technique and you obviously needed it and that's okay. And you're smiling, which is good. You're not crying.
Love it.
That's good. That was a success. That was perfect. Okay, so slide forward. Okay, good. And then try to rotate now to your right side. Beautiful. Let's try without your body. Better. How does it feel?
Other than here, it feels so much better.
So much better.
Here, it
Okay.
still feels...
So you're pointing anteriorly, okay, and you're pointing just above your clavicle, okay? So I think this might be a scalene, okay, muscle. When you deep breathe, okay, take a great big deep breath in. Do you feel any pain up there at all? Zero zip zilch? Okay. And if I hold your shoulders down, try to take a great big deep breath in. You feel that up there at all? Okay. So let's try this. Try to turn to your left and extend backward this way. Ah, where do you feel that? Bam. Okay. Rest. Okay. So we need to do some scaling tissue work, okay? It's going to be easy and feel kind of nice. Okay. Come onto your back, please. Good. There you go. Have you come down from the excitement of that snap, crackle, pop?
I loved it.
Okay, good. Good. All right. Stay as relaxed as you can. And where you're pointing when you try to rotate is right there, correct? Or is it more anterior?
Well, that's one of them.
Right there. Okay. Very good. So very gently, okay, I'm going to slacken you here a little bit. And we're just going to do some kneading on that insertion. If that pressure is too heavy or if it starts to irritate you, just let me know, okay? And we'll go ahead and do a manual stretch of the same tissue in just a moment, but we're going to try to get a little bit of local blood flow to increase. A little bit of tissue reactivation here so that we can have a localized response exactly where your symptoms are. So the reason I like that particular technique that we did, it's more of a traction technique than it is a rotational technique. The thrust through your right zygomatic arch or your cheek was kind of upward. It wasn't across, so your head doesn't turn very much more than that locking position that we started in. And it's really this nice way of opening those lower cervical facet joints on the right side of your neck with more of a longitudinal force instead of a rotational force. Does that make sense? Mm-hmm. Okay. And so it's what we call an axial, A-X-I-A-L manipulation instead of a rotational manipulation. Doing okay? All right. Here we go, and we're going to stretch that same exact region. You don't need to do a thing, okay? Just stay nice and relaxed there for me. Take a deep breath, Susan, and as you exhale, I'm going to push your shoulder blade down. Go ahead and take a big breath. Good. Another big breath, and this time when you breathe in, you're going to feel as though you can't get all your air because I'm not allowing your rib cage to come up through your shoulder girdle. There you go. One more. And out. Excellent. Okay, in this position now, take your right hand and reach as far down the table as you can, like you're trying to reach for your heel of your shoe. Yeah, you feel how big that pull gets? Ugh. And rest. Good. And guess what? Did you feel that?
Yeah.
Did you feel that last little cavitation there?
Yeah, but it was a quiet one.
Yeah, we opened something up just by you stretching again.
Well, I'm wondering if I stretched to create this problem, because I tried doing all that this morning.
Well, is this problem new as of this morning? I don't think so, right?
No, but did I make it worse?
Maybe. Possibility. Sometimes we make things worse. I mean, if I'm being honest, we don't hit the nail on the head every single time, but, I don't think you made it worse.
Okay.
I don't think so. I think this is a culmination of you beginning a new exercise program, you sleeping in that hotel without your special pillow, and you not slowing down, and, let's go, I'm going to push through this.
I do have a new exercise.
I know you have an amazing new exercise program, but when you have symptoms like this, it's nice to kind of go, hey, what might I be doing that could potentially be aggravating an underlying arthritic cervical spine system or structure? And I don't know, because I haven't seen your program, but we'll look at it, we'll study it, and we'll understand, is there something that I'm doing or not doing that could potentially be causing this to creep its ugly head up again, Try to turn, see how you do. Much more range. Excellent. Okay, I'm going to give you one follow-up exercise, and it's going to combine a couple of things, okay? We're going to shut the door. So, Susan, this is a classic pectoralis stretch, just a general shoulder girdle stretch, but what I'm going to have you do when you get here is I'm going to have you couple it with a chin tuck. I'm going to have you take your chin and pull it in, much like I was doing for you on that exam table there. So, widen out your hands. There you go. Push that foot forward a little bit. There you go. Now, when you're here, I want you to look straight ahead, but draw your chin inward until you feel this little guy stretch here. Perfect. Maintain that position for anywhere between 20 and 40 seconds or until you feel the initial stretch begin to decrease, and then gently and slowly come out of there, please. Beautiful. And this is something hopefully you can set up at home. We're going to give you the tools, remember?
Absolutely.
Okay. Go ahead and come on out of there. And now, because you don't live sitting on my exam table, try your rotation. See how you do.
I can drive.
Look at that. That is more than 50% better.
I can drive.
You can drive.
And especially on the left side, I think that's more than, way more than 50%.
Good. That's a win.
Definitely.
That's the power of what we call manual therapy. It's good stuff. So I'm going to just quickly go over the stretches with you, okay? Simply, we're going to use the mirror so that you've got some tools that you can pull out of your toolbox on your own, okay? So remember, levator, scapula, okay? Here to here, okay? Really, really simple. The only position that you need to remember for levator is just look at your opposite armpit. There, hold. Take this hand and do not pull on your head, just place this. This is a placeholder. The way that you create leverage for the stretch, because it attaches to your scapula or your shoulder girdle, is you just take this arm and you reach to the floor with it, but you don't let your head move. This is an anchor. This is the mobilizing shoulder blade. When this drops down, all that tension is created in the levator muscle, but don't yank on your head, please. That's dangerous. You don't want to apply leverage to your head.
Got it.
Anchor this, the leverage comes from here. Excellent. Beautiful. And again, everyone asks, how long should I hold a stretch? Until the initial intensity begins to fade. It might be 15 seconds, it might be 20 seconds, it might be 40 seconds, I don't know. All right, and if you want to stretch the left levator, you're going to look at this axilla or armpit, okay? And you're going to bring this hand up, anchor, don't pull, and the leverage is created by taking, drop down, there we go. Leverage is created by reaching to the floor here. You should feel that right through there. Got it? Beautiful. Questions so far? Okay. And then trapezius, okay? So if you look at my head in the mirror, my right trapezius bends me to the right. My right trapezius turns me to the left. And my right trapezius extends my head. We're talking about upper trapezius. Traps is a huge muscle. It's got 3 component parts, but we're just talking about the upper part. So to stretch it on the right, okay, you need to do 3 things. You need to side bend opposite, okay, rotate toward, and flex forward. And then this is an anchor, not a pull. And again, you reach down here, and that's where you create the leverage for the upper trapezius stretch. You got it?
Side, rotate,
Forward.
forward. Okay.
We can email you pictures of this stuff.
Okay. Side, rotate, forward.
And around the back with the opposite hand. Here you go. There you go.
Got it.
Okay. And then to stretch your
Oh,
left.
did you hear
I
that?
heard that
I heard
cavitation,
that.
yes. As soon as you let go of the stretch, pow! So a lot of what you're experiencing here, I think, is muscular compression of the underlying arthritic joints in your neck. And they're aggravated. So if we can alleviate the muscular compression with tissue work and stretching, and occasionally add a joint mobilization if you need one to get out of acute lack of movement, pain, etc., we can do that. But the idea is not to continue to have to mobilize your neck over and over and over again with high velocity, low amplitude techniques. We want you to be able to manage this moving forward, okay? So side bend first. We're gonna go to the left, trap, upper trap, side bend, rotate toward, flex forward, and again, the hand comes back and around. You hold and you anchor, and you drop this hand down toward the floor. So stand up tall. There you go. Now drop the arm. Good. Excellent. What do you got? Feel okay?
Yeah.
Try turning. See how you do? Wow.
Get better.
Get out of town.
I can see better. Look at
Nice.
that.
And then how about to the left? Beautiful. Okay. That's a successful first visit. What do you think?
I'm all for self-management,
Okay.
but I have to have knowledge. So
Okay.
thank you for imparting the knowledge.
You're welcome.
And the teaching was excellent.
Thank you. Thanks. Any questions on the facet joint mechanics
The
or?
visual was perfect.
Okay.
I got a visual, I have an auditory, I have a sequential, and then I like that you're going to follow up with a diagram or something or email on the app for me to be able to reference.
Upper trap, levator stretching, pectoralis stretch in the corner with a simultaneous chin tuck. That's all we're going to give you today. More than 3 on your first visit is a little overwhelming, I think.